the recording. Then we go to our previous slide about signs and symptoms. And yes, Hatap Khalid is joining us. Well, now there are 9 students, right? So the information about signs and symptoms, the difference between them. Sign is for a doctor, and symptom what the patient can really feel and tell the doctor about. Now let us have a look at the slide which describes one of the conditions, condition A. We should decide whether these are the signs or symptoms. Some of them can be both. So have a look at the list of signs and symptoms, and yes, Ayham, please.
Yeah, doctor, for the first one, it is symptom.
I mean, blocked nose is a symptom, right?
Yeah, miss.
What about the other lines here? Number 2, what is it?
The rise temperature, it can be sign and can be symptom at the same time.
What about the others?
Oh, the third one also.
So there is a strong echo. I can't hear you.
I said the third one can be sign and also can be symptom.
Okay. Headache, worsen, bending.
Miss, can I?
Yes, please.
I think it's the symptom.
Because the patient feels it. And runny nose is what? Hello.
Hello, Miss, what? Sorry.
Yes, runny nose. Well.
Yeah.
Is it a sign or a symptom?
Symptom.
Well, actually, we can see it says that symptoms are blocked nose, headache, runny nose, and maybe raised temperature. Sometimes the people do not feel the raised temperature, and so it depends. If the patient says that his temperature, the temperature of his body is raised, this is the symptom. But if he doesn't mention this, the doctor should just measure it himself, and it will be a sign for a doctor. The same about tenderness of sinuses. Well, the patient has blocked nose, but he doesn't know about anything about sinuses. So this is a sign for a doctor. And well, the condition B, Mazir, please. Will you comment on this?
Raised pulse would be a sign. Vomiting, diarrhea would be a symptom. Dehydration would be it could be a sign or a symptom as well. Abdominal tenderness could be is a sign, and abdominal pain is a symptom.
Exactly. Well, you are right. So sometimes it's not clear to the patient. So I mean, he does not control his pulse. If he does, this is a symptom. If he doesn't, this is a sign for a doctor. Of course, vomiting and diarrhea are symptoms because the patient feels himself. You are right about dehydration. Well, some patients just see that they are dehydrated, or can say that because of the diarrhea they are dehydrated, or but most of the patients do not notice this symptom. That is why this is a sign for a doctor to help with the diagnosis. And tenderness, abdominal tenderness, is also a sign. Well, and so which diseases the signs and symptoms might relate to? the first condition, condition A. What is the disease? Can you think of any?
About the blocked nose,
Yes,
I
all
think
these
it is
symptoms and conditions connected with the symptoms and signs connected with condition A. What kind of disease does this character have?
I think for the blocked nose, I think it is the flu.
Flu. Right. What else? So.
For the raised temperature, I think it is the fever.
And if we see all these signs and symptoms in complex in one person, it can be flu, fever, some infectious
Flu, fever,
disease.
Virus infection.
Okay, yes, right. And well, sinusitis is also possible because there is a tender over sinuses, right?
Yeah, that's right.
Okay, and condition B. No, what can we say about this person? What kind of condition is it? What kind of disease? Yes, Abdullah Yunus, please. Yes, Abdullah.
Yes, Miss. About the restful symptom.
I mean, we have already discussed this. I mean that
Okay.
what is the disease as a doctor? Should you help the patient?
I think about it. Symbian. How it's called?
So,
Asthma.
sorry, will you repeat, please? The problem is located where? Where is the problem here? Is it in the chest, in the hand?
I think it's in the belly.
So abdominal problem, yes?
Abdominal, yeah, abdominal tendons.
So what kind of abdominal just diseases do you remember? Which diseases which give us such symptoms and signs? Can it be, for example, problems with the stomach, like indigestion? This is called like gastritis, right? Is it possible?
Yeah.
Yes, Miss Right. Yes, possible.
Yeah, and for example, if it is, can it be appendicitis?
Yeah, or it could be any bowel syndrome, irritable
Yes.
bowel syndrome.
Yeah, for sure.
Okay.
Yeah.
Okay, so good. And now let us focus on this slide, and on your own make a list of the signs and symptoms you would expect to see in a patient with pneumonia. So first, I would like to be sure that we understand what pneumonia is, which kind of body systems is it connected with? Is it digestive system, cardiovascular system, or yes, Denise?
It's connected with a respiratory system.
Respiratory system, right. Okay, now let us make the list. Just 1 minute for you. Let us do it individually, and then we'll compare our list. So please write signs and symptoms, then we'll discuss. Now.
Okay, doctor.
Well, so what are the signs of and symptoms of pneumonia? Ayham.
So, doctor, there is a lot of more than one sign and symptom for pneumonia. The first thing I think it is cough, fever, sweating, shaking chills, shortness of breathing, rapid and swallow breathing, and also the fatigue and low energy. These are the signs for the pneumonia.
Great, you mentioned almost everything. There is Khalid Raji. Would you like to add anything?
Yes, Miss. Fever, sweating, and shaking chills.
I mean,
cough,
what we haven't mentioned. So Ayham has already said about this. Can you think of any extra other symptoms? and
Okay,
signs?
confusion, especially in older people, and nausea and vomiting, especially in small children.
Great. Okay. So, and Denise?
Yes, we have also symptoms of pneumonia at the sound of crepitation in case of auscultation. As also in heavy cases of pneumonia, we also can see ascites. What about additional signs from the patient? Is pain in the movement of the patient, of the rotation of the body. Also, we can see elongation of lymphatic nodules near armpits, or also as night sweating.
Okay, we've said about it. Yes, so you just speak like a real expert in this disease. It looks like you are an experienced doctor. Let us continue and focus on the language which was used by the doctor. So when, as a doctor, you speak to a patient, you need to use non-technical language, and we were speaking about this. The language that the patient can easily understand. Let us look at 2 example questions. The question, which verb means precipitate and which means start? So there are 2 questions. The first one is, when do the attacks come on? Instead of come on, what should we use? What is the meaning of? Yes, Ayham.
I think it is mean when it is start.
Yes, when do the attacks start? As for the second example here, are you aware of anything that triggers the attacks? Let us listen to Mazir.
Anything that causes the attacks?
Causes the attacks, or are you aware of anything that precipitates the attacks? Yes. Okay. Precipitate is a more technical word, so that is why it is suggested to use the common word trigger. And if we have a look at the following slide, we can see here the practical exercise where we should replace the technical words which are given in italics and highlighted in blue. We should replace them with non-technical words from the list which is given to the right. Sometimes we need to change the form of the word. Well, first let us have a look at the first sentence, and now let us listen to the student whose name is Abdullah Yunus. Read it, please.
Okay, miss. So the first sentence is we're going to have to perform a new test. We can replace it like start.
No,
To start, if you test.
have start here on the list. Please use one of the words from the list which you can see to the right
Oh,
of
one of the way.
screen. Mhm. Yes.
To do.
instead- To
To
do.
do a few. To do a few tests.
Exactly, exactly. Okay, let us stop here. And now I would like you to replace the words individually. Just 2 minutes to you to complete this task, and then we'll check it. Okay.
Okay, doctor.
Mhm. Well, now let's check. Lina, read sentence number 2, please.
She's suffering from a very bad bout of flu. We can say she has a very, or she's had a very bad bout of flu.
Oh, she's got. Mhm, good. Well, so Mazir, please.
Okay, it might be a good idea to refrain from fatty foods for a while. We can use avoid fatty foods for a while.
To avoid, okay. Well, Abdullah.
Okay, he's susceptible to many illnesses. We can use prone prone to many illnesses.
Yes, he's prone. Okay, well, Yasmin, please, the next sentence.
You said the cough is intermittent. We could use that to come and go.
So it sounds like you said the cough.
To come and go.
No, can't. If you can, will you just use the grammatically correct form in the sentence? You said the cough. Is it to come, or we should change the form of this phrase to come and go? If it is, yes, please help us.
Comes and goes.
Exactly, the cough comes and goes. Okay, Busaina, are you here?
No, she's absent.
I see. This is the person who is missing. Okay, Ayham. Number 6.
Number 6, your cough is persistent. I think we can replacement it with they're all the time.
Just without any changes. The cough is there all the time.
There
Or
all the
should
time.
we? There is a question mark at the end of the sentence, so you should ask the question.
Is the cough there all the time? I think.
Exactly. Yes. Right. Kadum, please.
Yes, it's difficult to adhere to any kind of the life change. We can make it stick to.
It's difficult to stick to any kind of changes. Okay, Dennis.
Okay, you won't have to be admitted.
Yes, to instead of hospitalized. Okay. Then Khalid Raji.
Yes, Miss, you are scheduled to see the nurse in the allergy clinic next Tuesday.
Mhm. Instead of you are scheduled. So
Miss,
who can who knows?
Can I?
Yes,
miss?
please. Yes.
We can use Pocket.
And the form of book will be you are
Yeah, you are Pocket to see the nurse in the allergy clinic next Tuesday.
booked. Okay, this is the verb. Well,
Yeah.
this is the way we just try to avoid some difficult words just to help the patient understand the doctor. And well, so I would like you to use the phrases to make questions with the non-technical words and role play conversation between a patient who has a flu or a cough and a doctor. The doctor should ask some questions about when patient complained. The doctor should follow the Socrates model. We were speaking at one of our previous class, and the doctor should ask some relevant question like when is there due and so on. Like in the example, are you booked to see, do you find it difficult to stick to medication? Does your cough come and go, and others? And try to use the words which are here to the right, like to do, stick to come and go there all the time, and so these kind of phrases. Now we needed volunteers. One is a doctor and the other is a patient, his patient. Who would like to be a doctor? No volunteers?
Maybe Miss, you can choose.
Yes, I can. So, Lina, you are a doctor, and Mazir, please, you are a patient. Start, please, ladies.
Do we ask any questions?
The doctor asks, sees the person, greets the patient, I mean, and so the patient just, you remember that the patient has a flu or a cough and answers the doctor's questions. Start, please.
Okay. When did you start experiencing these symptoms?
Around 3 or 4 days ago.
Have you always experienced a blocked nose during this time?
No, only yesterday it started having a blocked nose.
Are you allergic to anything?
No, I don't have any allergies.
Have you ever had any medication, any nasal medications?
When I was younger, yes, but recently I stopped taking it.
Is your coughing persistent, or does it get worse at certain times?
It gets worse when I wake up in the morning.
Do you have any pets?
No.
Have you been in cold temperatures lately?
No, not really. I've been staying home all the time.
Does your cough come and go often?
Yeah, no, it's persistent cough.
What is there? What else is there?
Oh, well, the doctor, you should recommend, give some recommendation, because the patient comes to you for consultation, so the patient needs help. What would you recommend?
I would recommend to avoid cold temperatures or avoid places where it's cold and to stay warm. I'd also recommend to drink, to stick to warmer drinks for the time being. I'd also recommend flu tabs if a fever were to ever come.
Okay, okay, very professional piece of advice. Thank you, ladies. Well done. Well, it looks like when you used persistent and which was all the time, the cough is there all the time. Yes, it's looks like hard to understand what, but the patient is educated enough to understand it, and the patient use this word herself. Well, great. And now let us turn to the next stage of our class, and here there is the next part of the conversation between Dr. Dixon and Mr. Bloomfield. When doctor asked some questions about the general history. Now we are going to listen to his questions and write down the questions that he asked about these things, about appetite, bowels, waterworks, and sleeping. So these pictures represent some body systems like bowels. This is they are shown in the first picture. This is a part of the digestive system, and waterworks are the organs that the organs involved in that deal with extracting water from the body, yes, like kidneys and these things. And sleeping is, yes, we understand this now. Now let us listen and write down the questions that the doctor asks. Now.
Listening 3.
Can you hear?
Yeah, doctor.
Yes.
Okay. Do you smoke?
No,
You drink?
just socially. Maybe a couple of beers a week, nothing more than that.
Is your appetite okay?
Yes, I never seem to have any problems on that score.
Bowels okay?
Yes,
Waterworks okay?
yes,
Sleeping okay?
yes,
General health okay otherwise?
yes.
I think we'd better have a look at you. Could you just pop behind the screen and...
Well, so what does the doctor say, Abdullah?
Is your appetite okay?
What about bowels?
And about bowels, is bowels okay?
And then,
Yeah, and waterworks okay?
and sleeping okay,
Yeah.
right? So
Sleeping, yeah, sleeping okay.
yeah, he uses one and the same structure of questions, and actually he shortens the questions. Well, maybe he asked the question in the full form, the first, but then he repeats only part of the question. And so if we move here to the next slide, let us just, we need to understand just what the question, what is the real structure of the question. So we need to expand these short questions, like in the example. So if somebody says, you've been off work at all, the doctor says, it means that the correct form of the question is, have you been off work at all? Let us listen to Khalid. Khalid. Khalid, hello. Khalid is not here, So this is minus. And Khattab. Is Khattab here? Also minus. Well, so let us listen to Yasmin, please.
Okay, so the first one, you eating well. It could be, have you been eating well?
Yes, okay. Can you comment on the other questions? Yasmin?
Okay, your appetite okay. We could say, has your appetite been okay?
Possible.
You sleep okay. Are you sleeping okay? Or yeah. Number 4, you passing water a lot. We could, have you been passing water a lot? Your period's okay. Have your periods been okay and had any diarrhea?
Have you had?
Have you had any diarrhea and lost any weight? Have you lost any weight and been living there long? Have you been living there long?
Okay, thank you. So, well, yes, and you see that in the conversation, of course, we can shorten the questions, but it doesn't mean that we do not know how the question is formed. And if we move to the next slide, here there is a yes, there are some pictures. You remember that we were speaking about so the social history, and these pictures represent some social problems. What kind of social problems are they, Mazir? They're in picture
Okay,
1.
so
Picture
with A, the person is homeless. So that is one of the social problems. He's not living in a clean environment at all.
Okay, it's cold outside, right?
Yeah.
So he sleeps rough means so he's not comfortable while sleeping, this kind of thing. Okay, so Denise, what about picture B? Denise? Denise, we can't
Yes,
hear.
I'm here. I hear.
Yes.
What is it? Okay, the picture B can see this problem like a resettlement, crowding of people that increase of epidemic situation. Also, we can see the girl on the second bed floor. Also, we have problems with clothes and total depletion of the place or personal space.
Yes, so it can cause even some psychological problems not connected with hygiene. Well, and well, I am pleased about picture C. What is the problem here?
The girl is still young and she's smoking. Also, at the same time, she's smoking in front of a child.
Why can be it a social problem, not individual problem?
Because she affecting the child mind. Maybe the child when sees someone older than them, he try to make what he do. So when this young girl smoking, maybe the child try to smoke like her.
Exactly. Yes, and it's not. It can also influence the people around this girl more straightforward, like it influences their body, their health, like it's bad.
Yeah, also maybe it is affecting the lung of the child, the smoke.
Okay, and then the next picture is for whom? Kadum. Can you comment on
Uh,
Jim?
It's about the fast food. It's dangerous about for the health because it have like many oils and like this.
And so why it's okay?
And
it's-
eating too much.
Yes, and what do we call the condition when people eat too much, and so how they look? So
Like fat.
yes, this is overweight, or
Yes.
there is a special term, the medical term. This is obesity, right? So this that the obesity can cause various problems with health. And of course, you're right about unhealthy food. This is junk food, so which influences the digestive system. Okay.
Also, doctor, especially the boy is still young, and in this age, when you be fat, you will meet a lot of problems in health by the future.
What kind of diseases are connected with the overweighting?
Maybe because the fatty acids or the lipids in the body, he will have the stroke in his heart and something like that.
I see. So that is why it's important to know the social history, the conditions the people live in, just to speak about the right diagnosis. Okay, now
Doctor, maybe
yes.
they will have a diabetes.
Diabetes, exactly.
Diabetes
This is the first just thing that comes to my mind when I see this kind of people. Okay,
Yes.
thank you. And yes, it looks like we need to yes, to stop the recording and